PJ, I'm Jen, and I'm a child life specialist.
Hi, Jen. It's nice to meet you.
It's so nice to meet you. My job is to help kids and families when they have to come to the hospital, and I heard you might be coming soon for surgery.
Yeah, and Jen, I'm feeling a little bit nervous about it.
Yeah, that's okay, PJ. It's normal for kids to feel a little nervous when they come to the hospital.
Yeah?
Yeah. One of the things I can do is explain a little bit about what's going to happen so you feel a little less nervous. Most kids tell me that after they hear what to expect, they feel a little less nervous about the day.
Yeah.
So when you come to the hospital, you're going to bring your grown-up with you.
Okay. Could I also bring my favorite teddy bear?
Of course you can. And when you come in, you might be feeling a little bit hungry. You're not allowed to have anything to eat or drink the day of surgery.
What? No, breakfast?
I know. Your belly has to be empty before surgery. It's really important that you don't have anything to eat.
Okay.
And when you come in, you're going to bring your grown-up with you to the surgical floor, and they're going to give you a bracelet to wear that has your name on it.
Oh, cool.
And your grown-up's going to have to sign a lot of forms. When the nurses are ready, they're going to bring you back to one of our rooms, and they're going to take what's called your vital signs.
Ooh, I think I've done those at a regular doctor's appointment.
Yes, you have. They're going to take your height, your weight, and your temperature, which you've definitely done before, the one that just goes across your forehead.
Yeah.
They're also going to take your blood pressure, where they use this little cuff. It goes on your arm and gives your arm a hug.
Right, and then it lets go.
Exactly, yes, it doesn't hug for too long. The other thing they're going to use is what's called a pulse oximeter. It's a little Band-Aid that goes on your finger, and it wraps around and lights up red. Can I show you?
Yes, please.
Just goes like this. Very cool. And this one tells the doctors how much oxygen is in your blood, which basically tells them how you're breathing.
Wow, a Band-Aid for breathing.
It's pretty cool.
Yeah.
While you're waiting to see your doctor, you can watch a movie, do some arts and crafts, or even play some video games.
Wow, that sounds kind of fun.
There's a lot to do. You're going to meet a lot of people the day of your surgery, and all of the nurses and doctors who come in are going to be wearing what's called scrubs. That's the uniform nurses or doctors wear. They kind of look like pajamas, though.
Whoa! Do I get funny pajamas, too?
You do. You have to change into hospital pajamas. Do you know why?
No.
That's okay. Hospital pajamas are to make sure that everything that goes in the operating room is super duper clean. So we make everyone change when they get here. The nurses, the doctors, even you have to change your clothes before you go in the operating room. One more person you'll meet before you go in the operating room is the anesthesiologist. Can you say that?
Anesthesiologist.
Very close. That's the doctor in charge of helping you go to sleep. The anesthesiologist decides if you're going to get sleep medicine through a mask, which looks like this, or through an IV, which looks like this. If you're going to get your medicine through a mask, we can actually pick a flavor to put inside to make it smell good.
What? Really?
Yes.
My favorite flavor is strawberry. Can we do that?
I do. I just happen to have strawberry here. Why don't we put some smell in it? Here you go. You can give that a smell. Does that smell good?
I love that. It's so yummy.
Awesome. We can also decorate your mask with some stickers. I have some fish stickers here. Do you want to put some on?
That's so fun.
Here, let's see. We'll put some on right here.
Yeah.
And now it looks really fancy. So when right before you go in the operating room, some kids get a little medicine to drink before they go in, and some kids have a doctor who has to write on them with the marker.
They draw on me?
They do. It doesn't hurt at all, though. It's just a marker.
And I'm sure it washes off, right?
Exactly, yes. When it's time to go in the operating room, some kids choose to walk, some kids ride in a bed, and some kids choose to ride in a wheelchair.
Ooh.
Do you have a choice for yourself?
Can I ride in the wheelchair?
I think so.
Cool. And what about my grown-up? How did they get to the operating room? Or do they come with me?
That's a great question. It's up to the anesthesiologist if they have your grown-up go in the operating room with you. If they do go in the operating room, they have to wear a suit over their clothes just to make sure no germs go in the operating room.
Are they going to look silly?
They might look a little silly. And when you go in the operating room, there's a lot of stuff in there, a lot of equipment, a lot of machines. But it's important that you know it's not all for you. There's a lot of different kinds of surgeries that we do here at the hospital, and they store all the different kinds of things in there. The room is very, very bright and kind of cold, so the nurses will give you some warm blankets to wear to keep you nice and cozy.
Okay.
And there's a lot of nurses and doctors in the operating room with you, and they all wear the scrubs that we talked about.
The funny pajamas.
Exactly. They also wear hats and masks just to make sure it stays very, very clean in the operating room.
And I'll have on my funny pajamas too, right?
Exactly, yes. They're also going to give you some monitors to wear in the operating room. A lot of the ones we saw and some new ones. So the new ones they're going to give you to wear are these ones called Ekg Stickers.
Oh, wow.
They are super squishy and sticky, but they don't hurt. Very good.
Oh my goodness, that was so squishy.
Very sticky. Now they put this sticker on your chest. What do you think they're listening to?
My heart?
Yes, exactly, your heart. These are heart stickers. They just listen. They're also going to give you the blood pressure cuff that we talked about. Where does that one go?
On my arm.
Exactly. And they're going to give you the pulse ox. Where did that one go?
Finger?
Excellent. Very good. And all of these machines connect and beep a lot, but none of them hurt. And then when it's time to go to sleep, they're going to give you your mask to breathe through. You want to give that a try? You can practice.
Okay.
Very good. You just take nice, big, deep breaths. Very good. Now, some kids decide that they don't like the smell of the sleepy medicine, and that's okay. If you don't like the smell, you can just breathe through your mouth like you're blowing out bubbles. Like that. Perfect. Exactly. You're a pro.
Thanks.
Now, the mask is going to make you go to sleep, and it's going to make you stay asleep. And you're not going to feel anything the nurses or doctors are doing during your surgery. You can't feel anything, you can't see anything, and you can't even hear anything. You're all the way asleep.
Okay. What about when I wake up?
That's a great question. So when the surgery's all done, the doctor's going to bring your grown-up to join you in the recovery room. That's a room where you can rest after surgery. When you wake up, you're finally allowed to have something to eat and something to drink.
Awesome. Snacks.
I know, because you've probably been pretty hungry all day at that point.
Definitely.
And when you wake up, you're still going to have all the monitors on that we talked about. So the sticker on your finger, the stickers on your chest, the blood pressure cuff, and you're going to have something called an IV.
What's that?
An IV is a tiny straw that the doctors can use to give you medicine.
Can I touch it, please?
Absolutely. Good job. It feels soft, like a cat's whisker.
Kind of like a straw.
Exactly.
It's really bendy.
Exactly. And it's the way they can give you medicine into your vein, and they can give you medicine while you're sleeping because you can't really drink medicine while you're asleep.
Jen, I know that I'll be asleep during surgery and I won't feel anything then, but will it hurt to have surgery when I wake up?
That's a great question, PJ. So you're right. While you're asleep, you won't feel anything. When you wake up, you might feel a little sore where your doctor did your surgery, but the nurses and doctors will give you medicine to help you make you feel better. If anything hurts or anything bothers you, your job is to tell the nurses and the doctors, or even your grown-up, and they can give you the right medicine to help make you feel better.
Will my grown-up...
Oh, sorry.
Will my grown-up be with me when I wake up?
Yes, your grown-up will be there. And the nurses will make sure that your grown-up knows how to take care of you and how to take care if you have any pain when you get home.
Am I going to go home after surgery or stay in the hospital?
So some kids spend the night in the hospital or a couple of nights, and some kids go home right away after surgery. It's up to your doctor, so you can ask your grown-up and they can ask your doctor.
Okay.
I hope that makes you feel a little less nervous about coming to the hospital.
Yeah, wow. Jen, that really helped me. I'm feeling a lot better. Thank you so much.
I'm so glad, PJ. I'm glad I could help.